CDC has been closely tracking the BA.2 sublineage of the Omicron variant carefully. The variant has been in the United States for about the past 2 months, and it has been slowly increasing in proportion compared to BA.1. This week, we estimate that BA.2 represents about 35% of circulating variants nationally. As we're learning from our colleagues in Europe, Asia, and South Africa, where BA.2 has resulted in varied peaks of cases, there's no evidence that BA.2 variant results in more severe disease, nor does it appear to be more likely to evade our immune protection. However, it does have increased transmission in comparison to the related BA.1 Omicron variant that circulated in the US this past winter. Over the past week, we have seen a small increase in reported COVID-19 cases in New York State and New York City, and some increases in people in the hospital with COVID-19 in New England, specifically where the BA.2 variant has been reaching levels above 50%. This small increase in cases in the Northeast is something that we are closely watching as we look for any indication of an increase in severe disease from COVID-19 and track whether it represents any strain on our hospitals. We have not yet seen this so far. Nationwide, cases have been steadily decreasing since the Omicron BA.1 surge. While this is good news, we do expect that cases may continue to fluctuate, including increases in individual communities, which is exactly why the COVID-19 community level metrics are in place. One way that CDC and our public health partners collaborate is by monitoring potential increases in cases and transmission is through the COVID-19 wastewater surveillance system. Currently, we're seeing a modest uptick of sites reporting an increase of virus levels in wastewater in some communities. In fact, over the past 2 weeks, we have seen increasing wastewater signals in New York City and parts of New England, where we are now seeing increases in cases and some increased hospitalizations. But I want to emphasize that these upticks reflect minor increases from very low levels to still very low levels. But sustained trends over time can give us an early indication of COVID-19 infections in communities. So these are the areas that we are watching carefully and an example of the interplay of our data systems that we use to inform our public health decisions. If cases do go up, we have the framework to implement additional layers of prevention strategies at the local level to swiftly protect individuals and communities. CDC will continue to use all of the tools in our toolbox to closely keep an eye on any increase in COVID-19 in communities, including early indicators like wastewater surveillance, any uptick in cases and hospitalizations, and any changes in our genomic surveillance that monitors for circulating variants. I'd like to emphasize that if cases rise from the Omicron variant or any other variant, we have the tools, vaccines, boosters, tests, and therapeutics to be prepared. But continued investment in these tools so that they are readily available when we need them remains critical. I know Jeff and the Secretary will talk more about the consequences of funding, but from a public health standpoint, it is critical that we continue to provide people with the tools to keep them, their families, and their communities safe.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.